All right, good morning, everyone. It's good to see those who have hopped on the call so far. We're still waiting for some other folks to join us, of course. But it is 11 o'clock, and we'll be getting ready to start the call here in a moment. Once again, my name is Christine Brown. I'm the Director of Member Engagement here at the Chamber. And it's great to see so many familiar faces and names hopping on the call. Just a quick announcement before we get going. We are actually in the process of winding down this webinar series, the Path Forward series, since we are starting to reopen our doors and figure out what our organization looks like moving forward in terms of hosting more in-person events and getting back to a little bit of normal, what we're terming the next normal. So you'll be seeing a lot fewer of these webinars, but we actually have something pretty exciting in the works that we're looking to put in its place. A series of workshops that are most likely going to be hybrid events of in-person interaction and education, as well as a virtual experience as well, since we're hearing and seeing that a lot of folks still would prefer to have a virtual experience, as we continue to navigate through COVID. So I'm happy to say that's in the works, and we'll have more details coming out about that probably in the next week or two. So keep your eyes on your email. And as always, I do want to thank some of our partners in particular who have helped make this series possible. Office Depot, Eide Bailey, BBSI, and Wells Fargo have committed to this series and have helped underwrite the work that we're doing in this series. So I want to thank them. But I also want to thank Kamal. He's on the line today representing Prominence. Prominence is another one of our great partners. And we're so happy to have him, and also Helen on the call today to tell us a little bit about what it's been like to navigate healthcare during this time of COVID. We know that it's been a source of, that healthcare has really, felt the brunt of this disease in terms of its response. And so we're looking forward to digging in and hearing a lot more about what the lay of the land has been like from two of the experts. So as we're getting going, I'm wondering if Helen and Kamal, if you guys would mind introducing yourselves and telling the attendees today a little bit about what you do.
Helen, go ahead. I think you're on mute.
I'm on mute. Okay. See, there you go. Technology is great when it works, or when you know how to work it. So my name is Helen Lindholm, and I am fairly new as the CEO for Northern Nevada Medical Center. I was at St. Mary's for 13 years prior to coming here. I'm a nurse by background and have been in healthcare my entire life. And that pretty much sums me up.
Excellent. Well, as the daughter of a nurse, I want to say thank you, and we can't appreciate you enough. And it's great to have you in your new role at Northern Nevada as well. Kamal, over to you.
Yeah, hey everybody, I'm Kamal Jemmoua, and I'm the CEO for Prominence Health Plan, responsible for our health plan activity within Nevada, Texas, and Florida, and then our ACO development, or Accountable Care Organization development for our parent organization, UHS, which also it is in essence is sort of we're a sister company for Northern Nevada Medical Center, et cetera, in the Northern Nevada market. So glad to join everybody. Thank you, Christine, for having us.
Yes, absolutely.
Thank you so much for having us.
Absolutely, it's my pleasure. And thank you so much, Kamal, for the work that you're doing to provide in quality insurance to so many Nevadans. There are so many who benefit and so many who need it more than ever. So thank you for the work that you're doing as well. So we'll go ahead and start with you, Helen. I know that you mentioned, that you're new to your current role as CEO at Northern Nevada, but you've been a leader in healthcare for many years. Tell us a little bit, about what your experience has been like coming on as CEO and then experiencing COVID. Just tell us a little bit about what the last couple of months have been like for you.
Yeah, I'm going to turn this around a little bit, if I may, because of something that just happened that I just found out about, we just found out about. There was a bill passed in the Senate yesterday for the state of Nevada, and some of you may know about it. It's a business liability protection for exposure to COVID-19 by third parties, and it is proposed to be covered by SB SB4, sorry. Section 5 of this bill excludes medical facility from this protection. It especially excludes for-profit organizations. And what that means for us is if somebody comes to Northern Nevada Medical Center as a visitor, as a vendor, as a patient, and down the road become COVID positive, they can turn around and point their finger at us that I must have gotten it at Northern Nevada. I walked by the unit where you have positive COVID patients, and so on and so on. The deal was struck between the Nevada Gaming Association, the Culinary Union, and the Nevada Attorney Association. And it really threw the hospitals under the bus. Nonprofit hospitals are excluded. They are included. So if anybody contracts COVID after having been at a nonprofit hospital or healthcare facility, they are protected. This also excludes and puts at risk downstream healthcare facilities like skilled nursing facilities and others that are also for profit. I have to say, in all my years of healthcare in this country and Sweden, where I came from, I've never seen anything like this. To exclude for-profit hospitals and to put us at such risk and big liability is frankly scary. So we will be reaching out to everybody that we know, and I'm going to ask for your help as well with email, Twitter, Facebook, Instagram. Happy to send out language. We want to stay open. We are the only industry that cannot turn customers away, if you will. We don't want to do it either. But by law, we cannot turn customers away. Anybody that comes to our emergency room, we have to take care of. So the liability and the risk to our organizations is huge.
Yeah,
so on that note.
Yes, thank you. I know it's watching legislation unfold it's an eye-opening experience, especially considering all the myriad needs that exist in our community and the myriad businesses who need protection. There are certainly a lot of things to consider, and thank you for sharing your views. And I think the answer, is luckily, at least in our democracy as it stands, the same, that we have the ability to reach out to our elected representatives and share our views with them, and share our concerns with them. And so, we at the chamber will always encourage that democratic dialogue to happen, with anyone, to share their views with their lawmakers and encourage their lawmakers to represent their interests.
All right. Thank you. And so back to your question. I'm sorry I took up a little bit of time with this, but I feel this is really important for us as a community. So as I said, I've been in healthcare for a long time, and I started at Northern Nevada Medical Center in March of this year. 10 days after I started, the COVID pandemic hit, and so it was like drinking from a fire hose, which is a good way of learning a new organization. I joined UHS because I'm so excited what our organization and parent company is doing and will be doing in our community. So right now, UHS's assets in the Northern Nevada region are already substantial. So Northern Nevada Medical Center, obviously, is ours. Most of you know that we are in the process of building a new hospital in the south side of town, Sierra. We also have 2 behavioral health hospitals in our region, Willow Springs, that is nationally known, and West Hills, that have been here for quite some time. In addition to that, Northern Nevada Medical Center is opening up our first freestanding emergency department on August 28th, and there are 1 or 2 more to come. We also have a large and quickly growing medical group that is also part of UHS and Northern Nevada Health Systems, if you will. And as Kamal mentioned, we are sisters and brothers, what? Yeah, something like that. Yeah, and then we also have some joint ventures, and Quail Surgery Center is one of those. And UHS has looked at our community and realized what we already know, and that is that it is a very quickly growing community with lots of opportunities. And so for a national, actually international organization to focus money, investment, time, and efforts on Northern Nevada region is really exciting. And I get to work with Kamal, which is also a plus.
Absolutely. And especially at a time like this, it's good to have, as you said, brothers and sisters, family in arms, working together in lockstep to address the needs of our community. Absolutely.
So quickly on COVID and how it started here, hospitals are really pretty well prepared for any infectious disease. We deal with flu, SARS, we deal with tuberculosis, we deal with a lot of infectious and communicable diseases all the time. So we were prepared for this particular coronavirus. What we did not know is what nobody knew at the beginning, and that was how it was going to spread, how initially it was very lethal. That has since thankfully changed. We also were not aware of how easily it was spread. We all now know that. But we had all of the processes in place. And at Northern Nevada Medical Center, we have an amazing team of clinicians, physicians, and other disciplines that already had very strong protocols in place of how you deal with patients that have a virus that can be transmitted. We were also very fortunate, and thanks again to UHS, that we have never been concerned about running out of PPE, personal protective equipment. We've always had plenty of masks, face shields, a different mask that staff wears, and also patient, because we give masks to our patients as well. So while it was concerning, and it still is concerning for our country and our world, Northern Nevada Medical Center was very well prepared.
Fantastic. That seems to be luckily, a message that continues to resonate throughout the region, that, though other parts of the country have struggled to secure PPE, have struggled to respond to the crisis, Northern Nevada at least has been positioned really nicely to respond. And that's obviously very encouraging to hear, for those of us citizens in the region who, you never know when it's going to be you never know when you're going to need that care. So it's comforting to know. So Kamal, I'd like to hear a little bit about your experience now. Prominence also has been in the trenches since the beginning of the pandemic. Can you share what your experience has been like in terms of providing insurance to your clients, taking on new clients, and perhaps globally what the experience has been like for insurance carriers as a whole?
Christine, I think first and foremost, just in reaction to some of Helen's comments, we're obviously, as a health insurance business, we are 100% in essence sort of a representation of a network of providers, facilities, et cetera, that are deep in the trenches, truly caring for patients right now. So major appreciation from our perspective out to the provider system, and particularly I would say, given some presence in multiple markets in Northern Nevada, I would say the provider system in Northern Nevada has done an incredible job, I think, at sort of managing and dealing with sort of the current state or the pandemic as a whole, both from staying safe, but also I think as it relates to just sort of reacting to all the active changes that have had to occur. So we're at the end of the day, I think, most dependent on our provider system, and we're grateful to all the activity they have done, the leaders like Helen who have really driven sort of a lot of that change and worked in the trenches around leading teams through a lot of this activity, and the physicians, et cetera. I think a couple things as it relates specifically to us as a health insurance business, or just as a business, I think similar to a lot of the businesses that are participants or members of the chamber who are involved in some of these conversations. The first and foremost challenge I think that we had to deal with was just sort of the idea of suddenly having to adjust to sort of a remote sort of workforce environment. I would say 90% of our employees had to immediately sort of go to working from home in order to maintain appropriate sort of safe social distancing, et cetera. So that was, I think, probably adjustment number one. And I think I speak for a lot of employer groups who had to sort of figure out how to adjust to that. Fortunate for us, we were in kind of a very sort of deep voice over IP integration, et cetera. So people were able to sort of move to home pretty rapidly. We'd had quite a bit of sort of bench strength built into our experience to be able to do that. We do have a lot of remote employees in some other states, while most of our core employees are here in Northern Nevada. But the team, the leadership team as a whole, the Prominence team as a whole, adjusted to that extremely rapidly. The second, I think, element is, how do you just sort of sustain culture of your workforce during this environment? And obviously an environment that, as I think we've all come to accept, is it's not going away anytime soon. I think it's here for a while. We've got to sort of adjust to that cultural change. So there's been a lot of sort of effort around, how do you engage employees in sort of a digital world, so on and so forth. So a lot of activity from that perspective, because ultimately they serve our clients, right? And in order for us to provide our clients sort of that best experience, we've got to sort of take care of our resources and our people, employees, et cetera. Specific to the insurance space, honestly, some of I would say the most significant challenges have been trying to support, particularly, I would say, our employer group clients on our fully insured business on the HMO side, particularly as they either, in some cases, have been businesses that were impacted by some of the economic sort of downturn, and trying to just sort of adjust and be flexible to their economic reality. And from the standpoint of payment processing, timing of payment, renewals, trying to make sure that they could continue to cover their employees. And then in some cases, I think we saw some employers do really well during this time, and they had an influx of employees, but they wanted to make sure they could provide coverage, et cetera. So we really tried to adjust and adapt as a local health plan to being very flexible to many of those requests or needs from our employer groups. And then, of course, the other area is just adjusting drastically. I mean, for a while there, as COVID was really setting in, I would say early April, May, there was daily sort of regulatory changes that were occurring that are impacting the industry from a healthcare standpoint as a whole, but could have downstream implications. Most pertinent, I would say, is ensuring that we could still enable provider access through telehealth, or ensuring that there weren't barriers to members or employees accessing healthcare, co-insurance, et cetera. So adjusting some of the reimbursement and some of the configuration and the mechanics around that. A lot of that was something that you had to adapt to very rapidly. I think it's somewhat settled, but now I think we're seeing some of the ramifications, as Helen referred to, with certain bills or legislation that we've got to monitor to ensure that it doesn't negatively or adversely affect the health system, because that's the last thing we need right now. So I think overarchingly, that maybe that gives you some perspective. I'm not sure if that answers the question, both from how it impacts us through to how it impacts the insurance business. But we're super excited about the enablement of access through telehealth. I think that's just been an incredible sort of what I would call silver lining of COVID-19, so to speak.
Right, and that's a great example of an infrastructure that was already in place, but will probably maintain a little bit more prominence in the future, even as people are able to return to physical doctor's visits. They may opt for telehealth instead, and it's good to know that even though we had to, buffer those systems very quickly and adjust on the fly, those systems were already in place and functioning, and now they're functioning better than ever, and they will continue to in the future in order to supply healthcare, according to the needs of the people. So that's a very encouraging silver lining to know about. Speaking of downstream effects, I know that you're still unraveling some of those, and some of those may take years to develop. But at least in the immediate horizon, do you see, for instance, any insurance increases that could be coming down the pike as a result of COVID-19?
Yeah, that's a good question. So this is something that, as you can imagine, is part of sort of industry sort of adaptation or reality. There was, I think, a ton of hypotheses that kind of went on around this. There was a decent number of headlines, but I think overarchingly what we've seen, and I think what you're seeing out of some of the headlines from broader, sort of much larger insurance companies, health insurance companies in various markets, is there's two elements to it I would describe. The first is I think we saw some fairly significant suppression in utilization as a whole, particularly in April and May. And in some cases, I think people deferring care that they really needed to have. And so I think one of the things I would sort of state, and Helen would definitely support, is this healthcare system has done a lot of work to ensure that they're safe. So deferring care that is necessary is definitely not the right thing to do. But we did see a significant amount of suppression in people sort of engaging in elective procedures, surgeries, ER utilization, et cetera. And so while not necessarily good from a healthcare perspective, it did create what I would describe as some potential room for offsetting what I think we're going to start to see, which is increased utilization and increased cost due to COVID. And some of that is very regional in nature. So I think, as we described earlier, Northern Nevada has done a really good job, I think, at sort of managing sort of the penetration of COVID. So we're relatively optimistic that there won't be a significant adverse impact if we can keep the current penetration of COVID under control, so to speak, in regional sort of markets. Now, I can't speak for markets like, my example is South Texas. We've got some presence in South Texas where they've had massive sort of penetration of COVID. There will likely have to be some adjustments that occur because of the utilization impact. But I think on a regional basis, when you think about markets like Northern Nevada, we're optimistic that if we can keep this thing under control, we won't see sort of adverse impacts to rates from a health insurance perspective. But fingers crossed, obviously, we've still got some time to go here.
Right, absolutely. There's no way to be certain, but it sounds like, efforts are being made to mitigate any of those downstream effects that might result in insurance rate increases. So thank you for sharing your perspective on that.
Our actuarial departments would not be very happy with my statements there. I did not provide sufficient caveats.
All right. Well, this has already been such a fascinating call, and we're already almost done with it, unfortunately. But before we start to wind things down, I do want to once again encourage folks on the call, if you have a question for either Kamal or for Helen, please go ahead and use the chat function, and I'll try and reserve as much time as possible at the end of the call for any of your questions. But now is the time to ask them if you have any burning questions. Otherwise, I'm just gonna continue on with my own. So this next one could be suitable for either of you. Aside from telehealth, are there any other efforts that either of you are making to better enable and ensure adequate access to healthcare in the region through COVID-19?
Well, I will say, you mentioned telemedicine, and telemedicine is definitely here to stay. There's no question about that. I'll tell you one anecdotal story. Our board chair is a nephrologist, an amazing physician, amazing man. And when he told me that he was doing telemedicine visits with his patients, I thought, well, how do you possibly do that? So he explained that, for patients with renal failure or renal issues, blood pressure and swelling are both, really important to keep track of. So the patient takes the blood pressure with, him on the phone and them on the phone or an iPad or something, and shows it to the doctor, and then points their phone or pad down on their feet so he can see if there's additional swelling. Now, obviously, this would not work if it was a newly established patient, but for patients that have chronic disease and sees their doctors often, and I thought that was a really good example. The other thing that that we began to do pretty early in our medical group is curbside visits. So you can drive up to any one of our clinics. You don't have to get out of your car. A clinician will show up and talk to the patient about their symptoms. Sometimes it is necessary to go in and have a visit, and other times you can go out with an otoscope and look in someone's ear and say, "Yep, you need some antibiotics for, for an ear infection." So it's interesting, and I think a lot of this is here to stay.
Right, that's fascinating. I hadn't actually heard that clinicians were able to provide care curbside. That's fascinating.
Yeah.
And honestly, especially for those who, perhaps are afraid to walk through the doors of a hospital, it provides them another avenue, no pun intended, but another avenue with which to seek care. That's fantastic.
Yeah, Christine, the only couple things I would add to that, I mean, everything that Helen said is it's incredible. Some of the things that the health system or provider system has done to adjust to trying to provide care, enable care. A couple things that some health plan that we're doing or sort of as part of the provider system we're helping enable is, just a reminder, telehealth in current state can be over the phone or video. So if you need care, you can actually just call your provider and there's reimbursement mechanisms for that right now. And the one thing I would encourage all of us to do is advocate for that to continue. A lot of it is economically aligned, i.e. some of what's helped reduce the barrier to access is the fact that CMS, as the sort of largest payer within the country, changed their reimbursement approach, but they haven't necessarily clarified whether that's going to persist beyond COVID. So my encouragement would be that we all sort of advocate for that. And then I think as health plans, we need to follow suit. So we will always take a very strong position that we will continue to support and advocate for telehealth. Other things that are being done is sort of nurse to home. We have a number of instances in which we've got nurse practitioners or nurses that are going to patients' homes, particularly for our senior population that need more intentional care. We're doing that. We also have a number of care coordinators that are on the phone that are just proactively outreaching to patients that we know generally have a number of chronic illnesses, et cetera, that need just some general attention or just somebody to talk to. So we found that that's really, really helpful during this time. So basics in many ways, but things that I think are very beneficial to people just from a human behavior perspective or psychological perspective.
Absolutely. I'm glad you mentioned care coordination. I feel that those are some of the unsung heroes in our healthcare system, truly, who are able to just speak one-to-one, human to human, person to person, and help them navigate their care needs. That's something that I know I've benefited from in my life. And I hope that it's something that continues to grow within our healthcare system as a form of advocacy. Fantastic. Since we're coming in on the end of the call, just a couple minutes left, and if we go over, I thank you both for bearing with us, and thanks to those on the call. If we go a little bit over time, I'm not seeing any questions in chat, so I'm just going to close with this one question for both of you, and if you could both answer, that would be fantastic. Even though we cannot in any way, and no one is expecting this, but we can't predict the long-term implications of COVID-19. But what are some of your biggest concerns moving forward through COVID and coming out of COVID as it pertains to the healthcare system and public health in general?
So from my perspective, there are a couple of things. Northern Nevada as a region, we're doing well. We're doing well because people who live and work in our area are complying with the mandates. And we, the mask and safe distance and washing your hands is becoming more and more important. So as we see an uptick in the numbers in Southern Nevada, Northern Nevada region is still staying, okay. So it would be, we're not safe, we're not out of this. So practice social distancing, wear your mask, encourage everybody love, care about to do the same. My other concern, which has been ongoing since the pandemic in March, is deferring care. And Kamal alluded to that a little earlier. And we are seeing a downturn that has not changed in our emergency department of patients not coming to the emergency room when they should. We have a Safe, Trusted, Ready campaign that we have rolled out to all of the various media. And the message really is, it's safe to come to the hospital. If you are sick, seek care. Don't defer, don't delay your annual health checks or immunizations. And that is my biggest concern, is that we would see an uptick of other chronic diseases in the long term for people who at this point choose to not seek health care.
Yeah, Christine, I would second everything that Helen said, and just pile on to that. There are some real sort of downstream implications to deferring appropriate care or care that's necessary, and I think there's a ton of research and headlines around this in many cases where we've seen chronic conditions get a lot worse for patients in the instances that they have not pursued the care that they need. So I think that's sort of a concern that we have from a public health perspective. There's a concern that sort of persists. And the other reality is that this, I know we keep calling this sort of a wave, and I think in our mind, psychologically, we want this to just sort of be a short phase, but it's here to stay for a while until a vaccine is sort of found that can help sort of, do something more about, sort of impeding this or stopping this. It's a way of a life for a little bit. So deferring care isn't necessarily going to make sense. To just find out that the system's safe and trusted. Trust the system to an extent. Find the care that you need, and also just adjust. And we can't encourage people enough to sort of follow the social distancing sort of expectations, the masks, et cetera, to protect both ourselves and protect, our loved ones and individuals that are out there that we interact with. If we don't do that, I think we all know that there's significant more implications that are negative from that perspective. The other elements, I think, is, there are positive sort of perspectives, just that we hope that adoption of telehealth will continue, access to care, and how we think about healthcare will change over time. But there are significant potential negative implications if we're not careful as it relates to accessing care when it's needed currently.
Right, and that's a great place to leave it. That there, we have a fine line to walk, and there's caution on both sides to be aware of. That we have, because trust in so many sectors is eroded. It's important to be trustworthy and to build trust. And it sounds like you're building as many bridges as you can by reaching people where they are. And also, knowing that, that this is something that is here to stay, and that we need to, as the general public, start placing our trust in, in these institutions that are here to help. And it's a two-way street. So I think the big message is, everyone on this call, myself included, let's make sure to get in our annual physicals, all of our preventative care, age-appropriate care, and to not put those things off. And I thank you both for joining us on this call today. Do you have any other closing thoughts before we sign off?
None from my perspective. Thank you for having us. This was great. Happy to contribute. Really appreciate the chamber and what they're doing to host these sessions. I think very, very beneficial. Thank you guys for what you're doing.
Thank you. It's our pleasure.
Echo Kamal's comments. Thank you so much. Really appreciate it.
Absolutely. Thanks so much to you both for all the work that you're doing in our community, and hopefully we will see you again soon.
Awesome. Thank you.
All right. Bye, everyone.
Take care, everybody.